This segment is sponsored by Lighthouse Dental Group.
Well, making time for a dentist visit can often be the last thing on our to-do list.
Dr. Lisa Christie from Lighthouse Dental Group shares why it is so important to keep up with regular dental visits and screenings. Take a look. Well, we're here at Lighthouse Dentistry, and I get the opportunity to chat with Dr. Christie. Let's talk about preventative dentistry. What is it, and why is it so important?
Preventive dentistry incorporates a wide scope of things. It's everything from routine cleanings and exams to x-rays, fluoride, it can be sealants, it can be adjunctive take-home therapies of special prescription toothpastes or other types of remineralization products that we can actually make for people to put in trays to prevent white spots from braces or reverse some of the effects from maybe some not so good habits as teenagers with getting white spots that you can sometimes see on people's teeth, the bright white spots. There's a way to minimize those and help make sure that they don't decay and become an issue down the line.
Well, let's talk about those dental x-rays. Why are they so important? What ages should we start having those x-rays done, and when are they really crucial? And as well as how often should we have them regularly done?
We typically try to start getting x-rays, these bite wings down here, when kids are about 5 or 6. Sometimes size of mouth or gag reflexes, things like that prevent us from getting them that early, but we do our best to get them at about 5 or 6. They show us in between the teeth to make sure that there's no decay, and there's a spot here where this little boy has some decay started. He's still going to have that tooth for 2 or 3 more years, so that's something that we want to go ahead and treat. Panoramics we take typically around 8, 9. They're a great screening tool. It makes sure that we can see all the replacement teeth, the permanent teeth that are going to come in and replace the baby teeth. It also shows us that he's in the lucky category and that he only has 2 wisdom teeth forming at this point. So it's great for screening. Sometimes on adults we even see calcified lesions in the carotid artery that let us know that there might be another problem lurking. They'll show us anything that's abnormal too, because we can see the whole jaw and the sinuses.
Well, you talked a little bit about adult x-rays. I think sometimes parents are better at keeping up with their kids' health care than they are their own. So how regular should they come in for preventative dentistry along with these x-rays? We
take the bite wings at least once a year, sometimes, depending on the situation, the person, 18 months. A panoramic x-ray like this or individual x-rays of all the teeth is about every 5 years. So they're great screening tools because on the bite wings we don't see tooth roots. So the roots are also important to assess for, is there infection down there? Is there, something else going on below the surface that we can't see on our routine screening x-rays. So typically it's once a year. Depending, sometimes 18 months for our routine screening x-rays. We recommend that we see people twice a year. Even denture patients should come in at least once a year just for a fit check, make sure their tissues are nice and healthy. We'll keep up with a panoramic to just make sure that their bone and everything is okay. Restorative dentistry is, to put it in real simple terms, it's fixing the holes. Or maybe it's even making something look prettier. It can even mean replacing teeth, and we actually have a model here of one of the newer technologies that's been about for about 10 years, but it's a partial denture. It replaces teeth, but it's almost see-through and it's really flexible. So it's lightweight, there's no metal, it snaps in, and you would never know that a person's wearing it. So it's one of those great options for people who maybe want to replace their teeth that they might have lost a long time ago. It can be anything from doing a sealant on a child to prevent the decay, which is, a sealant is, I call it nail polish for teeth. It just seals and flows over the top of the tooth so that there's no pits or grooves where stuff can collect. We do fillings, root canals would be considered restorative. crowns, bridges, replacements. So I mean, anything you could think of that we would need to fix a tooth and make it functional, those are, the things that we would do here in this office.
Well, from preventative dentistry to restorative dentistry, there is something for every patient here at Lighthouse Dental Group. Lighthouse Dental Group is doing a special offer. Mention Hometown Living and be entered to win an electric toothbrush and teeth whitening system. It's at $150 value. That's amazing. And so for their location, their phone number is 269-465-3001. You can also find them on the web and also on Facebook as well. What a great special offer and deal just by saying you watch our show.
Love that. Coming up.